This person says, my father is suffering weakness in his legs. He has been a healthy person, and is 86 years old. He had an MRI of his brain done, and which shows a stroke, which he was never aware of.
Okay, it's very common actually to have asymptomatic strokes. Okay, it can happen from head trauma, it can happen from infection, it can happen from vascular event. Okay, but the first thing that you need to do when you have somebody in that age group who's feeling weak, asthenic, which is sort of a lack of energy, really, is to make sure that they're not hypothyroid. Okay, and hypothyroid of the elderly is extraordinarily common. TSH does not go up in the elderly. Okay, so what you have to do is look at their temperature, look at their metabolism in general, but also you need to make sure they don't have Addison's disease, because adrenal failure is also very, very common as you get older. It's one of the ways that the rose falls off the bloom falls off the rose. Okay, so while I'm going to go out kicking and screaming, but my mom has both hypothyroidism and Addison's, and not being treated properly, adequately, or really in her case at all, she is now totally incapacitated. So for this gentleman, the first thing I would do would be to desperately get some blood work, looking at cortisol level, pregnenolone level, androstenedione. I'd be looking at testosterone as well, and looking at him upside down and sideways.